Black barbers in the United States trained as mental health advocates can support the mental health of customers in profound ways. Barbers can prevent suicide as well as community and domestic violence in their neighborhoods. Organizations such as the Confess Project, which is America's first mental health barbershop movement, aims to do just that. I spent the past year doing one-on-one interviews with 32 Black men and women barbers who come from rural, suburban, and urban locations such as Arkansas, Colorado, Illinois, Indiana, Kentucky, and Mississippi. My research was supported by the invaluable insights of Mr. Lorenzo Lewis, the founder of the Confess Project. I wanted to know, what role, if any, do barbers play as mental health advocates, suicide prevention, and interpersonal violence gatekeepers? How, if at all, does awareness of these issues and/or trainings designed to address them impact how barbers serve their communities? And when necessary, provide opportunities for interventions? And finally, how, if at all, have the barbers' personal journeys influenced their work as gatekeepers and their service to the greater community? For me, these interviews were life-changing, and I want to share what I learned from these barber interviews with you now. For the next 8 weeks, I will share 2 videos with you per week. Each week will have a particular theme, such as the role that women barbers play in their communities. Let me give you some background. Suicide ranks as the 3rd and 4th cause of death among 15 to 24 and 25 to 34-year-old Black males in the United States. The vast majority of these occurrences are caused by firearms and suffocation. Any intervention which provides time and distance between someone attempting to commit suicide or hurt others and hinders the means to do so can mean the difference between life and death. In the general population, almost half of all suicides are decided within 10 minutes, and nearly 3/4 of people who attempted suicide and survived did not make a second attempt at their life. Kayla Johnson, a staff psychologist who works for an institution of higher education, described the ongoing mistrust that some members of the Black community have with mental health professionals in a recent interview, saying, "Going to a therapist means that something must be wrong with you, or you don't have enough faith in God. There's also pressure to keep problems to yourself," she said. "There's a kind of level of secrecy about things that happen." Experiences with traumatic life events, for example, adverse childhood experiences or ACE scores, and poor environmental conditions can be attributed to some of these injuries and death. Data shows Blacks reported significantly higher levels of ACE exposure compared with whites. The number of ACEs experienced was positively associated with self-rated fair to poor health, frequent mental distress, heavy drinking, and smoking for Blacks and whites. With disproportional high ACEs among young Black and underserved communities, associated risk factors can compound and carry over into bodily injury and/or death in the forms of both interpersonal violence and suicide. More specifically, in regard to mental health, acute life events, lifetime traumatic experiences, and recent life events, childhood adversity, chronic stressors in relationships, finances, neighborhoods, found a graded association between the number of stressors and an increase in depressive symptoms. A combination of various life stressors and events can indeed have a great impact on mental health, lead to feelings of depression or hopelessness, and even precede or be attributed to avoidable traumatic injury and death. For Black communities in the United States, mental illness tend to be more severe, persist for longer periods of time, and are more debilitating than for any other race or ethnic group. More needs to be done to overcome these racial disparities in regard to the intensity of mental health issues, which often become intergenerational in nature. Interventions come in many forms, as community workers and researchers look for best practices to overcome these challenges and provide more acute support for these often overlooked and underserved community members. The problem is dire. Solutions need to come from all corners of society, and new avenues of support need to be considered and invested in more heavily. There are no easy fixes or even simple ways to understand such a complex challenge. Gatekeepers who are active members of society are in a position to offer mental health support, as well as aid in the prevention of suicide and interpersonal violence, due to their high levels of personal contact with others. Gatekeepers, whom members of the community often seek out for advice or opinions, may be able to persuade certain at-risk community members to overcome these stigmas and misgivings and reconsider getting mental health services, which in some cases could prevent injury and death. An accessible, non-judgmental, and personable gatekeeper, such as a barber, tattoo artist, nurse, teacher, or pastor in a church, may be able to provide a person with suicidal ideation or intent to cause harm to others support in their most dire moments of need. Considering these challenges, a more informal and casual setting, such as a barbershop, could serve as a key gateway component for helping marginalized Black community members overcome generations of stigma about these services. Their customers, whom they often see on a regular basis, open up to them in their one-on-one interactions, from lighthearted to more serious topics, both of which are important and made possible in the safe spaces of many barbershops. Barbers also frequently interact with people outside of the shop who otherwise cannot afford or don't have easy access to a haircut. They are the eyes and ears of the community. The barbershops themselves also act as invaluable nexus points where events such as Alcoholics Anonymous, AA, community lectures, and food drives can take place. With training, barbers may learn to better recognize verbal and nonverbal cues, or to discern particular changes in their customers' lives, for example, attitudes and behaviors, over time, and then address any potential warning signs as they arise. The results suggest that over time, Black youth have experienced an increase in suicide attempts, which is troubling because attempts are the most prominent risk factor associated with suicide death. Barbers as gatekeepers will be the key for bringing about meaningful systemic change. Even with just 1,000 trained barbers, more than 1 million community members are directly reached each year. When it comes to interpersonal violence, traumatic injury is the #1 cause of death for Black males under the age of 35 in the United States. Firearm homicides made up over 90% of these incidents. The personal nature of these violent crimes is significant. Traumatic injury incidents are often the result of factors which build up over time and which give people in the community many chances to intervene and prevent things from getting worse. Intervention is even more likely if observers have participated in relevant training and have the awareness and skills and confidence to intercede. With the high levels of interpersonal violence among young Black males, greater community grassroots involvement and training, such as that provided by the Confess Project, may be an important step towards stemming violence in these communities. A community-based public health approach to traumatic injury and death prevention describes among its main pillars a need for it to be broad and inclusive. It examines all possible interventions, including changing social norms and passing new laws, and it tries to engage as many people and institutions as possible in a multifaceted way, emphasizing shared responsibility over blame. Prevention works best when everyone is trying to help, looking for new and innovative solutions by sharing ideas within and between various at-risk communities in the United States could be a pivotal way of moving forward, overcoming the disproportional rate of traumatic injury and death among young Black males, and altering its course toward a more positive trend. But the stigmatization of counseling services among men of color and inequities related to access of services can often lead to an unwillingness or inability to get professional help when they need it most. More stopgaps or trained gatekeepers who can change misconceptions about mental health and set good examples for at-risk members of the community are needed. They can help mitigate violent injuries and death by providing support to those who show signs of mental health distress. For example, suicidal ideation, thoughts of violence toward others, etc. And in certain cases, even gently guide them toward receiving professional care and support. Addressing existing inequalities in the United States needs to be a collective effort, and one that considers a traumatic injury and death prevention public health model as a part of its arsenal for lasting systemic change. The study does not intend to propose generalizable causations, as might be found in a more quantitative analysis. This kind of qualitative research intends to look into the lived experiences and day-to-day lives of people of color who work in American barbershops. The following videos highlight leading themes from the barber interviews.